Hi, this is Jolene Cornelson, Care Home America. Today I'm speaking to the family caregiver on what to expect and how to proceed when there's a healthcare crisis. My dad recently suffered a stroke, and because I'm a nurse, everyone in my family looks to me for direction. Thankfully, I am able to coach them on what to do and how to navigate the healthcare system on my dad's behalf. But how about you? Do you have someone who can coach you through a tough time when emotions are high and literally when you face life and death situations? Well, that's what this series is for, to help you know what to do when someone you care for is in a healthcare crisis. First, let me paint you a picture of my elderly parents and their care needs. Dad is 93 and Mom is 89. Obviously, their advanced age gives you an idea that their abilities are very different than when they were young. Until recently, they lived independently with just some part-time help. But Dad has health issues that require care, and Mom is mentally sharp but physically frail. So they recently moved into a home where they can have 24-hour care. The caregiver was to provide care for Dad, and Mom would care for herself. This worked fine for about 6 months, but now Dad has had a stroke and we are in crisis again. Emotions run high in crisis situations. People wonder what's going to happen, what are we going to do next? You begin to wonder, will they be able to go back to the current care situation, or do we have to make different arrangements? Well, this is a crisis mode. Obviously, at first, you need to get them evaluated in the emergency room. See what's really going on. If they are admitted to the hospital and they are there for a 3-day stay, Medicare will then pay for 20 days in a rehab facility if that is needed. A rehab facility could be a certain wing of the hospital, or it might be in a nursing home, or it could even be a separate rehab facility. Things that are provided at a rehab facility include skilled nursing care, physical therapy, occupational therapy, or speech therapy. The first 20 days, that's what Medicare will pay for. That is a critical time for the person to see how much functional ability they can regain. But it's also a special, important time for identifying your options and creating a plan for what's going to happen after that 20 days. Because 20 days is what Medicare will pay for, but after that, then it becomes private pay. Here's some considerations. You need to figure out in that process of 20 days, what is the care level that is needed by them now? Are they stable in their health situation? Are they going to go back to where they were before? Are they going to be independent? What kind of care will they need? How much care? Who can provide the care? Is the care going to be something that can just be done intermittently, like a family member coming in to support them? Or do they need 24-hour care? And if they need 24-hour care, where is it going to be done and who's going to provide it? Also, in this big process, think about the person and who they are. Are they a very social person? Would they enjoy being in a large facility where there's other people around too and they could maybe make some new friends? Or are they very private people who would prefer to be in a private home in a smaller situation? You need to figure out their likes and dislikes and look at the big picture. Well, I drove 3 hours to visit my dad. He was admitted to the rehab facility on Monday and I got there on Thursday. Mom said, great, you can come to the care conference on Friday morning. Well, the care conference was scheduled for 11 a.m. and I spent the night with my mom, and she got up in the night to go to the restroom, and we found that she had some huge health issues of her own. She ended up in the hospital that morning, and so I had both of my parents in 2 different facilities. Talk about crisis mode, that's where I was at. So I left Mom at the emergency room to go over for Dad's care conference for the rehab facility. And the physical therapist there, the occupational therapist, said that Dad's care is progressing, that they're working things out, he's getting stronger every day. And so over the course of those 2 days that I was there, we figured out that Dad is going to be able to go back to where they were living before, and the caregivers are willing to accept him back and to do what is needed, even though his care needs have changed a little bit. Then after the care conference, and I ran back over to the hospital where my mom was, and only to find out that she had had an episode of heart pain while I was gone, and they had done a complete heart workup as well. So mom ended up in the hospital for observation. She had x-rays and an MRI and blood work and the whole workup. And thankfully, she did not have spinal fracture, compression fracture that the doctor suspected. So she was able to go home after that 24 hours. Now, but one of the things she said is that she didn't really want to go home. And so when somebody says something like that, you really need to look at what's going on. Actually, as it turns out, this last 6 months in the care facility, my mother has been still doing care for my dad in the nighttime. She told the caregiver not to do the nighttime care, that she would handle it. And my dad had been getting up to about 6 times of the night. So mom's not been able to sleep. Here she is still being a caregiver while paying for 24-hour care. So something has to be done. I interviewed with several different nurses of the care facilities, and they talked to me about different things, different scenarios on how to provide care for couples. And we've come up with a lot of different ideas. We'll talk about some of those in some of the other posts, but for now, think about how to proceed in a crisis. Consider the level of care that is needed. Is the care situation stable? Is the client's or your family members' health situation stable? How much care are they going to need? And if they're not going to be able to go back to the previous level of care, where are they going to go? What are their resources, and how can you work it out? This is Jolene Cornelson speaking to family caregivers on how to proceed in a crisis. CareHomeAmerica.com.